So today we are going to answer some of the questions that our viewer have asked. Most popular question that I got was tinnitus or like crickle. Our viewer said she is hearing cricket sound on right ear. Other doctors told her that she's just getting old. And so she's very concerned that her hearing may go away or goes down and may lose her hearing in the future. Or should she just consider it as part of the aging? So what do you think about that? And how, what kind of treatment or what kind of management can be done?
Yeah, so when you think about tinnitus, or in Korean it's imyeong, you have to think about it's broken into two different categories. One is pulsatile and one is non-pulsatile. And then even within that, we think about whether it's a continuous tinnitus or it's an intermittent tinnitus. So all these things are very important in helping me determine what the cause is and what we can do to work you up in terms of the different diagnostic tests that are available. So the biggest thing with tinnitus is it's a sound that the patient can hear, but no one else can hear it. So that's different from hallucinations, right? Because hallucinations are things that no one can hear at all. But then tinnitus are subjective sounds that the patients can perceive. So those usually fall into the non-pulsatile category, where they can be like crickets, they can be like high-pitched noises, or they can be like static sound. Some people even hear music, a lot of different varieties. You can also think about pulsatile tinnitus, where it sounds like they're able to hear their heartbeat. So they'll be sitting there and it may be positional and maybe non-positional, but they'll correlate the sound that they're hearing in their ear with their heartbeat when they check their pulse. So those are all very important clues in terms of what diagnostic test that I order. But the mainstay of tinnitus is that you have to get a hearing test in addition to an ear exam. An ear exam is for the doctor to determine if there's any physical causes for the tinnitus. Hearing test is to determine the function of the ear. Now, do you get tinnitus because of your age? You can. But I've also seen people in their teens and 20s with tinnitus, so it's not definitely age-related. I get it from time to time. It's annoying, but it's not necessarily something that occurs to everyone because of their age. But definitely because hearing loss is more prevalent as we age, that's when tinnitus becomes more of an issue.
So if somebody has tinnitus and you are young and it lasts a couple days, there's a good chance that you don't have to worry about it if you don't have any other symptom.
So when I think about someone young, I think about acoustic traumas that may cause tinnitus. So, with COVID, it's a little bit harder in terms of going to concerts or big raves or something like that. But acoustic traumas are one of the things that I suspect the most. You also have to think about whether it's unilateral or bilateral. When you think about tinnitus in general, bilateral non-pulsatile tinnitus are the most benign types.
So for this lady then, she is having cricket sound from the right ear. And as a primary care doctor, I take a look at the ear just to make sure that there's no foreign bodies or little insect or something which we actually find time to time.
Oh yeah.
So if the ear is clean, no earwax infection or something like that, then what would be the next step if there is a one ear having that kind of cricket sound?
It would be a hearing test.
Hearing test.
Yeah, and it's very important to differentiate a hearing screen from a hearing test. Or a formal audiogram, because hearing is perceived through the air and also through conduction. So a good example is if you take a tuning fork and you place the tuning fork anywhere on your skull, you're able to perceive the sound. And those are the subtleties that the audiologists have to sort out. Is there a conductive hearing loss? Is there a sensorineural hearing loss? Or is it a combination of? So definitely a formal audiogram is what's needed more than a hearing screen.
So at the end of the day, what kind of final diagnosis have you found who present as hearing a cricket sound?
The most benign situation is we're unable to find anything else, and you have tinnitus. That is most often the most frustrating situation because I'm essentially telling patients the current testing that is available to us is insufficient for you. And the reason for that is because tinnitus, the mechanism for why it exists is still not completely worked out. For patients with tinnitus that occurs with hearing loss, hearing aids are of benefit, and the quality of hearing aid that you receive really has an impact on how well the hearing aid is received by the patient and how much benefit they have with both the hearing loss and the tinnitus portion. But then, tinnitus can also come from infections. It can come from tumors. And the tumors are most often, it involves the eighth cranial nerve. And at its exit point from the brainstem, you can get an acoustic neuroma, which can cause a tinnitus. You can also get meningiomas in the area, arachnoid cysts. So those are all things that we think about in terms of non-pulsatile tinnitus. When patients have pulsatile tinnitus, we have to think about vascular reasons.
If somebody is having this cricket sound, then would it worth it to get an MRI of brain of this area?
So I think MRI plays a big role in an ear exam or diagnosing ear problems. But I'm very selective about who I get it on and what kind of MRI I get. For someone with tinnitus, I never go to an MRI without a hearing test because about 80% of patients don't need an MRI. It's a big waste of time, resources, and it's you're putting the kidneys at risk, right? One of my big projects in residency actually was to look at imaging requirements for tinnitus, and then also what kind of MRIs we can do to both improve cost effectiveness and also efficacy in diagnosing patients. So I have a good working relationship with my diagnostic radiology centers here. So for you or anyone else around here that wants to get a ear evaluation with the MRI, I always get a non-contrasted T2 weighted Fiesta protocol MRI to evaluate the ears.
Let's say randomly 10 people walk into your door
Yeah.
with a cricket sound on your right ear. 10 patients. What is the most likely diagnosis that you would just randomly guess without any if somebody is coming in, 60-year-old coming in with a cricket sound on the right ear? What would you think the most common diagnosis?
Most common is presbycusis or age-related hearing loss.
Yeah. So probably that's what she heard from other physician because she's just getting old. So if she's having that problem, does the hearing loss occur gradually, or if she's having cricket sound on the right ear, and then if this is just part of the aging and causing this sound, does she have a lot more chance that she's gonna lose hearing?
So there's two ways to look at it. If it's a gradual hearing loss with tinnitus, it's more reassuring. If it's an acute hearing loss with tinnitus, then I would be much more concerned about it.
So if somebody is not having hearing loss per se or just ringing, then maybe you just do watchful waiting and see.
I always get a hearing test, more so because if there's asymmetric hearing loss in association with asymmetric tinnitus, then it requires a further workup.
Okay. I know it's very, very difficult to give an answer because, like when we hear something, just like in my area, somebody said, my kidney doesn't work. What can I do? Or my GFR is 30. What can I do? It is impossible to give answer. So I like to, let people know who's watching that if you're watching because you want to have a definite answer or a definite solution, it is oftentimes very difficult to do it because the doctor has to get full workup in order to say what would be the cause and what would be the solution. And it'll be very different by people to people, even though symptom may be similar, right? So,
yes. Yeah. I think a lot of it hinges on the exam. And also, from a physician perspective, both whether it's kidney related, ear related, or anything else, my biggest alarm is to make sure that there is nothing sinister going on. It's always difficult to just diagnose yourself and treat yourself with Dr. Google or or Dr. B or
Right.
something like that.
Yeah, so they always want a definite answer by this, open time, very difficult to
Yeah.
give because many different reasons.
I
So
mean, medicine is very personal, right?
yeah,
So,
yeah. So
um,
if you're having this problem, cricket sound or hearing loss or ringing in your ear,
uh-huh.
definitely talk to your primary doctor and then get a referral to see a ENT for further workup.